I'll start. I'm Joanne Dusseault. I'm the Director of Medical Affairs at Briere Continuing Care, and I've worked with PAs since 2012, early 2012, in this role. So.
I'm Doug Maynard. I'm the Manager of Medical Affairs at Briere.
My name's Dr. Nicole Dunlop. I'm a physician at St. Vincent Hospital. I'm the medical director and chief of the short-term medical program. And I've been working with PAs since I started practice in 2013.
Actually, we applied to the Career Start, I believe in 2011, probably before, but we got actually funded through the Career Start program of Health Sports Ontario in 2011. And we're able to bring on our first PA that January 2012. We brought the PA, the reason we decided we needed a PA is our complex continuing care is over 330 beds at the time, 336 beds. And in complex care, there's limited physician presence. There's part-time physicians. They were only able to visit the patients a few times a week. We felt that there was a gap there that needed to be filled, and we thought PAs would be an ideal role to come into the organization to act as physician extenders and provide support to both the units, the patients, and their supervising physicians. So it was kind of a pilot in 2012, and it was so successful that we now are up to 3 PAs in that department.
Increased happiness of everyone involved in the organization is an honest answer. Increased patient satisfaction. Increase patients feel like they have more face time with the medical professional. They feel like they're getting better explanations of things, and they feel like they're getting better care, to be quite blunt. It takes a load off the medical staff. The medical staff are unbelievably thrilled and happy to work with the PAs any opportunity that they have. And for the rest of the team, so the nursing team as well as our allied health team, we do rehab here, so it's very team based. The entire team appreciates having that PA presence on the floor because it kind of centers and grounds the whole group. The PA is kind of the center of it all. Everyone in the team can go to the PA. The PA know what's going on with every patient. So literally increased quality of care and increased happiness and contentment of both the patient and all the staff. And I know that seems like I'm laying it on thick, but PAs have been a game changer for us in this hospital.
Yeah, and I would agree with that. I mean, I think from the time they came in, they've helped with our patient flow because they're on site every day. They're working with the physicians. They've helped us address things quickly in terms of changes in conditions. They've improved communication, increased availability, I think, as well. As we build our physician resources to match the patient acuity, PAs have, like Dr. Dunlop has said, have been a game changer in terms of ensuring that we have that presence on site and that linkages between the patients, the families, and the physician. So I think that's the big one. I mean, there's so many ways. They've helped on our committees at hospitals. They play a key role in us determining, various things, pharmacy and therapeutics, order sets, everything. So they've been such an integral part of our team, and they're so amalgamated into our teams that I don't think we could function without them. Mine's probably more on the administrative side. When they were first coming on board, I got the impression that it might be difficult to integrate them because it was such a new profession, and would people understand them on the unit? And it just wasn't our experience. It was such a good integration. They were so well accepted. We received such amazing feedback, directly, indirectly. I know we've done external reviews. They've spoken to, various people have spoken to our external reviewers. Same thing with them. The PAs have just been really welcomed into the organization, and I think that was the biggest surprise from what I was told to expect versus what we expected. And then I think the scope of practice, and Dr. Dunlop can probably talk about that a little bit, being a non-clinical person and seeing their role evolve, I think from a different perspective, is just the breadth of stuff that they can do and the competencies that they're coming with, I think for me has been a big surprise.
Yeah, so I wasn't here when we first hired our first PA, but I was here when our second and our third PA came on. I think what I can agree with Joanne, and what surprised me was the breadth of their knowledge. We have 3 PAs, for example. One is military, one was an MRI tech, and one was a respiratory therapist. So we have a broad area of expertise that they're bringing from their past lives as well. How much they can contribute and how committed they are to the team and to the group, I think, I don't want to say it was surprising, but maybe unexpected. I didn't expect them to get to the level that they're at as far as professionalism, responsibility, and really commitment to our program and to our patients.
I think one more thing I can add too is I didn't, I think, realize early on how much they would be working with absolutely every area of the organization, every specialty, right? Whether it's pharmacy, it's they're such a part of the team, but they're interacting with all the different specialties, disciplines, allied health, everything. So that was an eye opener for me. Kind of, I pictured them like extending for the physician, doing the physician piece, but not realizing how much they were going to work with our teams. And that's been great.
I would tell them is to do not hesitate, do not pass go, and do not look back. It will be one of the best additions to your institution. It increases your quality of care. It increases, like we said before, the contentness and the happiness of the patients and staff. Yeah, if someone was considering hiring a PA, I would strongly encourage them to do so.
From an administrative perspective, I would say also make sure that I encourage people to put the supports in place for the PAs as they integrate into the role in all aspects, and have a really good open communication. I think, it's a role that needs to be understood, supported, advocated for. So making sure that they have someone to talk to on a regular basis, that we can work things through together. That's really important, because I think then it removes roadblocks and lets them do what they're best at doing. So I think from an administrative side, that's what I've learned over the years. And I think we're still evolving in that learning. But I think it's really important to make sure you've got a really good communication structure for them, and that you're supporting them in their role.
What's unique about our hospital is, so we're a subacute hospital. So we're not acute care and we're not long-term care. We're somewhere in the middle. And there's really only 2 or 3 other organizations in the province that really can be parallel to us. We are severely under-resourced. And the impact that the PA makes in our hospital is impressive. We have many PA students that come through our building. And I definitely get the impression that a lot of the students would like to work in this kind of environment, because the PA plays such an important role and really makes a positive impact on both the patient and the staff and the entire team. And I think they can feel that.
Say just from the feedback from our PAs, because I'm thinking back to a conversation we had a few months ago, and I think they really enjoy the scope of work they can do. The thing about a complex continuing care environment is it's everything. We've got wound care, we have vents, we have dialysis, we have short-term complex patients, long-term complex medicine patients. So I think there's just, for them, I think there's a real development opportunity and growth opportunity within our CCC, and I don't think it's ever boring. So I think that's the feedback I've gotten from our PAs, is that they really enjoy the scope of practice that they have here and the opportunities that they have here.
And I think the learning curve is steep, but we ensure we take the time to properly train our PA specifically for our site. They usually get 3 to 6 months of kind of individualized training to work in our building. So I think.
And I will add, just, it's not a question you've asked, but we've really enjoyed the opportunity of students coming to do placements. Like, it started kind of as a trickle of 1 or 2 coming, and now we have a lot more that comes through. And I think that's been really valuable to us as well, because we do want to support the profession. And I think that's something that I would think that would be attractive for PAs in our organization as well. They get to actually be part of training other PAs with our physicians. And I think that's kind of unique as well. So I think that that's an attractive thing with our organization, is to kind of be supporting the profession as well as it continues to integrate itself into healthcare. I would like to thank all the PAs, the PA students, the PAs. I think they add such a value to our organization. and we've heard that from everyone they're working with. We have a long track record, over 10 years of working with PAs, and that my perception has not changed at all over that time. So we want to thank them for being such a valued part of the healthcare system. I think it's a role that really is needed as we move into the future, and we're happy that we've been part of kind of supporting that and developing that over the years. And we thank all the PAs and the province and outside the province, because there's amazing ones coming out of other jurisdictions as well, for the contribution they're making to healthcare.
I can't say it any better than that.
What about you, Doug?
I would just say that we're at a place at least in Ontario and probably across the country, where we really have to look at being creative with how we deliver healthcare services. The whole system is under strain. And when you're looking at, providing better care, we're always looking at how do you make better use of the scopes of practice that you have, whether it be allied health professionals or nurses or what have you. And I think when people are looking at reorganizing services or trying to do better for their patients, to consider what the physician assistant might add to the mix. It's probably not one of the specialists or the allied health professionals or the other healthcare professionals that first comes to mind, like a respiratory therapist or a pharmacist or a physio or occupational therapist or what have you. But I think it's something that people need to consider, because it might be that extra ingredient that really allows you to extend your services and really improve the care that you're able to provide to patients. So the message would be, don't be afraid to reach out and ask for more information about physician assistants, because it might be a solution to one of your problems that you're having.